Okay, good afternoon, everyone. My name is Jessa Prades, and this is my presentation about the racialization of sickle cell anemia and its effects on African American adults. So, for context, sickle cell anemia is a disorder that makes blood sticky, making it more prone to clotting inside a person. And it's a inherited disorder. So, in this data right here, 74,000 people in the US have sickle cell, and 93% of those people are African Americans. So, there is a prominence of sickle cell in African American communities. These are some of the symptoms, which includes fatigue, chronic bone pain, joint damage, ulcer pain, delayed puberty in kids, and vision problems. So, the issue that I want to touch upon is the racialization of sickle cell anemia and its systematic impact on healthcare for African American adults who have it. So, first of all, due to the prevalence of sickle cell in a particular group, it has been stigmatized and led to it being dubbed as Black disease with racist and derogatory undertones. So, and according to a data survey by the National Institute of Health, African Americans are sometimes also misconstrued as being lazy or drug seeking when going to healthcare providers for opioids in order to regulate the pain from sickle cell. And also from the data, Black patients have to wait 25% longer in emergency rooms than others before receiving their necessary treatment. So these issues create unhealthy stereotypes, racial bias, mistrust towards healthcare providers, declining quality of healthcare that they receive, as well as worsening conditions because of it. So the solution that I would like to propose is to create a film advocacy targeting healthcare workers as well as future healthcare workers about the significance of the problem. The film would feature African Americans who have sickle cell disease sharing their own personal experience with having sickle cell and the stigma that they face in clinical or social settings. Um, I also want the film to remind healthcare professionals of their oath to do no harm because this ongoing problem really decreases the quality of health for those impacted if they don't perform their duties properly. Okay, I believe in the efficiency of this proposal because a video is more engaging in comparison to other formats, and having those impacted tell their stories can really put a perspective for others to actually understand what they're going through. And I chose the target audience as the healthcare workers and future healthcare professionals to act as both upstream and downstream because stopping the racial bias in the current system works with spreading awareness in the current healthcare workers now. And for future healthcare professionals, it would teach them against the racial bias in colleges before they actually become practitioners. So the impacts that I want this proposal to create are improving quality healthcare, spreading awareness of racial bias in healthcare, and bridging trust and connection between patients and healthcare professionals. I want this to also be a step in erasing unhealthy stigma and stereotypes in hospital settings, reinforcing the vital condition of civic muscle and overall belonging, as well as health and safety. These are my sources. Thank you.
Hi, my name is Kyle Olsen, and my project is on the rate of homelessness and the cost of living in Contra Costa County. So, a brief overview I want to go over is that the Bay Area is statistically the most expensive metropolitan region to live in the United States. It is also has the third largest regional homeless population in the United States, and it holds the highest annual year-over-year rent growth rate in the United States. So the issue with this is how can low income and unhoused populations be expected to continue living in an area where the cost of living increases exponentially? So I placed a few keys up here. One key having an orange border, which means population, and another key having a blue border, which means financial. So looking over at financial one, we see that the asking rents of in Contra Costa when it originated in 2001, or sorry, 2000, quarter one, it was like roughly just $1,300, and it increased to quarter four 2022 to $2,200. That is about a 69% increase in subsidized rent. Now, considering these trends continue within like the next 10 years, it could easily reach around $2,700. Moving on to population one, we see that only there's a shortfall of 34,000 low-income renter households that do not have access to an affordable home, which is largely due to the increase in rent. And a high percentage of these populations lie within very low income, but mostly within extremely low income. Now, if we look over to financial two, we see that the state and federal funding, the state total has increased by 296. Oops, sorry, has increased by 296% from 32,000 to 130,000, and the federal total has increased from 151,000. I'm sorry, 151% from 95,000 to $239,000. Now, even though the federal total is providing the most, we are still increasing our federal funding locally the most. And if we look over, and if we move to financial free, we see that most of it is being put into rehab units instead of new construction units, meaning that most of it is done for like primarily health related causes. And not really just like people who just need assistance living. And if we look to population two, we see that even with all that funding, there is still a shortfall. This orange line over here, sorry, I mean this like red line, colorblind, is the current homelessness population, and right here is the homelessness support. Now, now this means that not everyone who is homeless is being able to get a room in a shelter. So all this funding isn't really helping most of these people who don't have homes, or for a matter of fact, people who aren't homeless and are just low income. Now, if we look to population free, we see that between 2000 and 2015, Contra Costa County experienced a 55% increase in low-income households of color, substantially higher than the regional average. And in population four, we see that the destination of movers by race, that Latinx and Black populations, around 82 and 77%, the highest of the four, were stayed within county, meaning that either they were able just to move into another region, another lower income region, or they became homeless because they weren't able to move since they were a lower income. And in terms of the total homeless population, from 2017 to 2019, an increase increased by a factor of 42.81%, which is largely attributed to the spikes in rent that we see over here on the graph. Now, the main outcome that I received from this is that the higher the income rose, the more it targets people of color and low income populations. So, which attributes to a shortfall in affordable homes and the inaccessibility for unhoused people. Now, a preventative solution, so we can assist people to stop becoming homeless, or just to like put a stop on these rent increasings, is to establish a $250,000 to $300,000 program that centers around collaborative action between the cities within Contra Costa that focuses on housing stability and policy. It relies on incentivized community input, brings in people from diverse backgrounds, probably people who've lived in experience such as homelessness, drug abuse, low income or minority backgrounds, working with city officials to make change in their communities, meaning they'll actually get hands-on legislative action. And since they're working with city officials, they'll be able to hold them to their campaign promises in order to deliver a more promising result. And it would work with already established groups such as YAB, the Affordable Housing Finance Committee, and East Bay housing organizations. Why it will work? There are already plans and committees to aid this problem. This would be a way for the people living in the Bay Area to voice their grievances and push policies that would support already pre-established organizations. This gives community-based organizations the opportunity to partner and make an even larger impact. In fact, one of the impacts that I'm hoping that this could possibly bring is reaching a rent freeze order in order to publish like a rent cap. And it may eventually evolve to establishing out-of-county partnerships, which means we could make even like bigger impact through is pulling more resources and just being able to help more people. Here are my sources. And I want to say thank you. Any questions?
Hi everyone, my name is Aayusha Bhandari and I am a rising senior at El Cerrito High School and also a fellow intern here at Health Career Pathways. And today I'll be discussing the elevated risk of skin diseases among agricultural workers in California. Next slide. So what exactly is the issue? California farm workers face daily and extensive exposure to UV rays because they work outdoors during peak sunlight hours and are regularly exposed to pesticides or other skin irritants. Many have limited or no access at all to dermatology care, and some lack proper personal protective equipment, also known as PPE. One farm worker and single mother said, quote, "It's something we farm workers struggle with a lot because we want to prioritize work and our health too, but we can't. At some point, you have to sacrifice something," end quote. Because of barriers like these, skin conditions often go untreated until they become much more serious, increasing the risk of dermatitis and skin cancer. Next slide. Here is some data that highlights the impact of the issue. To start, the most common type of cancer in the US is skin cancer, and farm workers face a higher risk because of long-term exposure to UV radiation while working outdoors. Research also shows that 50 to 60% of farmers develop a skin condition within 5 years of beginning agricultural work. Agriculture also has one of the highest rates of occupational skin disorders in California. The graph on the right highlights another major concern. In 2023, California had more than 687,000 pesticide applications, but fewer than 1% were inspected. This is concerning because pesticides can irritate or damage the skin with repeated exposure, so few inspections means unsafe working conditions may go unnoticed, increasing the risk of preventing skin diseases. Next slide. My upstream solution is to create a mobile skin outreach program. Instead of expecting farmers to travel long distances for dermatology care, this program would bring services directly to farms and rural communities. The mobile clinic would provide free or low-cost skin screenings, educate workers about UV and pesticide protection, distribute sunscreen and PPE, and also connect workers to follow-up care if needed. To make these services accessible, educational materials will also be offered in multiple languages so workers with limited English proficiency can fully benefit from the program. Next slide. This solution would be effective because it addresses several barriers agricultural workers face. By bringing dermatology services directly to farms and rural communities, workers no longer have to travel long distances to receive care. Early skin screenings can identify skin conditions before they become more serious. Providing education, sunscreen, and proper PPE can reduce harmful UV and pesticide exposure. And offering services in multiple languages helps ensure that more workers can understand and also use these resources. Overall, this program focuses on prevention, improves healthcare access, and also helps protect long-term health of the workers. Everyone deserves access to preventative health care, including the people who help feed our communities. Next slide. And these are just my cited sources, the sources I used throughout the presentation. Next slide. Thank you all so much for listening, and I'm open to any questions. Thank you.
Hi, my name is Carmella Ricau. My pronouns are she, her, and I'm a rising senior at Pinole Valley High School. This is my project titled Threads of the Self. Next slide, please. The issue I'm going to be addressing in this project is gender essentialism in children's clothing. Basically, mass market retail sorts children into strict categories based on gender. Girls' clothing is often characterized by pastel colors, soft imagery, and tighter, shorter silhouettes, while boys' clothing is characterized by darker colors, aggressive themes, and looser, longer silhouettes. Who this impacts unfairly is early elementary students, specifically ages 5 to 8. Developmental data shows that before and between this age bracket, up to 87.5% of children display severe cognitive rigidity regarding gender roles. This is amplified by clothing, as it creates narrow definitions of what it means to be a boy or a girl. This rigidity peaks during early elementary years, making it capable of directly driving classroom bullying and a fear of being isolated just for wanting to play or dress differently. With that being said, the outcome I'm trying to prevent is the suppression of a child's authentic identity. By stepping in early, it's possible to protect their mental health and avoid cognitive limitations on self-esteem and imagination. Next slide, please. To solve this issue upstream, I wanted to introduce a community-based developmental activity implemented in public schools designed to foster both childhood creativity and mental well-being. First, an informational parent pamphlet is sent home, and this pamphlet explains the psychological purpose of the activity and encourages families to share meaningful parts of their lives with their children, even inviting parents to collaborate directly with the volunteers, who are an important part of the solution. Next, public school students are given dedicated, independent time to express themselves. Because 5 to 8-year-olds are still developing their literacy skills, they will be creating a drawing of their interests, hobbies, and their biggest dreams, and it doesn't have to be career-related, it could be anything. Then teachers collect these creations, and community volunteers, specifically college fashion students and senior center citizens, pick them up. Volunteers collaborate off campus to turn these drawings and ideas into physical custom costumes. Finally, the volunteers deliver the costumes back to the school for a dress-up day, and the children permanently get to keep both their costumes and their artwork. Next slide, please. I think that this project is effective and innovative because it focuses on changing the child's environment by flipping the traditional commercial marketing model. Instead of forcing top-down gender labels onto kids, this project is building clothing from the child's internal voice outward. Remember the 87.5% statistic? Research shows that targeted cognitive activities can drop rigid stereotyping scores from 87.5% down to 73.22%. Through the process of drawing what actually matters to them and what piques their interests, children get to practice flexible cognitive activities, and by turning their final creations into custom costumes that don't rely on strict male or female norms, the costumes become a vital window of validation for their imagination and a permanent psychological reminder to a child that they're safe to be themselves. Individual expression becomes more normalized in the classroom, meaning kids stop coupling themselves and their peers into black and white boxes because the rules of what they're allowed to like are actively becoming dissolved. It's financially sustainable as the project reduces high district costs by pairing senior center tailors with college fashion students using university textile scraps, which are typically free because universities have a tendency to produce a lot of them. Lastly, the project is politically sheltered. In a time where schools face heavy censorship, parent pushback is neutralized by the informational pamphlet mentioned previously, which not only reframes the activity around creativity and community art, but also avoids making parents feel like their authority is being overshadowed through encouraging them to share their stories with their children and also inviting them to help volunteers out. Next slide, please. These are my cited sources that I used throughout the presentation. Next slide, please. Thank you. I'm open to any questions.
Hello, my name is Alex Mariscal-Lona, and this is my community-based project on preventing suicide in juvenile detention centers. So, the issue. Youth in juvenile justice systems are at a much higher risk of suicide than youth in the general population. Many enter detention centers with untreated mental health conditions, but warning signs are often missed. So, as a result of this, it is the number one cause of death in American juvenile detention centers. And well, because of this, detention facilities need better ways to identify youth at risk and provide timely mental health support before a crisis occurs. So, with that being said, juvenile detention centers need better screening, monitoring, and suicide prevention strategies. And this could help early identification and timely mental health care can save lives. So, causes and data. The causes can be because of stress of incarceration, depression and anxiety, previous suicidal thoughts or attempts, and or isolation or room confinement. And data that backs this up is 70% of incarcerated youth have been diagnosed with a mental health disorder, 30% have explicitly reported recent suicidal thoughts, 12% of detainees have reported a previous suicide attempt, and 90% of in custody suicides occur within the first month. And lastly but not least, one third of in custody suicides occur within the first 24 hours. And what these statistics are showing us, it's showing us that what it's showing us that mental health screening and early intervention are so important. For my upstream solution, well, my proposed upstream solution is a comprehensive suicide prevention program, which every youth should receive a suicide risk screening when they enter detention centers. Staff should also use direct language by asking clear questions such as, have you been thinking of suicide or have you been thinking of killing yourself? With this direct language, this will help the youth talk honestly about their feelings and be more straightforward. Something else can be is staff should also receive training to recognize mental illnesses and warning signs and closely monitor youth during their first month, which is when suicide risk is at its highest. So, why does this solution work? This solution focuses on prevention instead of waiting until a crisis happens. Early screening, direct communication, staff training, and close communication help identify youth who may not speak up on their own. And also, research consistently shows that facilities with comprehensive suicide prevention programs experience fewer suicidal incidents. And well, by improving these practices, juvenile detention centers can create a safer environment and can save lives by ensuring youth receive the care and support they need as fast as possible. And well, in conclusion, suicide among youth in juvenile detention centers is completely preventable by improving screening, using direct language, and training staff, oh, and providing early mental health care. Detention facilities can identify youth at risk and help prevent future suicides. My cited sources, and thank you.
Hi everyone, my name is Ella Calangian and I'm an upcoming junior at Pinole Valley High School. I'm going to be presenting my project, the Richmond Shop Map. Next slide, please. Okay, so to start, to understand why this project exists, we first have to look at the global fast fashion crisis. Fast fashion relies on low prices, cheap synthetic fabrics like polyester, and rapid trend cycles produced overseas. But the environmental toll is massive. Fashion production accounts for 10% of the global carbon emissions and consumes huge amounts of fresh water while polluting local water supplies. On top of that, 85% of all produced textiles end up in landfills or dumps every year. And washing synthetic clothes dumps 500,000 tons of microplastics into our oceans. The root of this issue isn't just clothing, it's overconsumption and consumerism. Brands now create up to 52 microseasons per year. Paired with social media hauls culture, we're trained to treat clothes as disposable items that feel outdated within a few weeks. This culture deeply impacts our community. Local independent shops and boutiques simply can't compete with artificially low prices and multi-million-dollar ad budgets of global online markets. When we default to online fast fashion, our local main streets lose foot traffic, vibrancy, and economic support. Next slide, please. Onto my data. If we look at the data, global fast fashion market sizes is projected to reach over $184 billion by 2027. Meanwhile, consumer surveys show that less than 15% of people currently prioritize shopping at small local businesses or independent boutiques. When clothes are thrown away, synthetic materials like polyester can take 200 years to fully decompose in landfills. Only 15% of clothing ever get recycled globally. And much of that is because overseas, where poor quality leads back to landfill waste anyways. Next slide, please. Okay, to go over my solution, instead of dealing with textile waste after it's created, I wanted to create an upstream solution that solves the problem at its source, the convenience gap. People often default to fast fashion because online shopping is fast and easy. The Richmond Shop Map brings local options into one easy digital directory. It highlights local thrift stores, consignment shops, vintage sellers, and independent boutiques right here in our community. This proves that shopping locally can fit in any budget while we're keeping money circulating in our local economy. And then if you could please click the link that I attached. So here is just an example of some places that I put on my list, on my map. As you can see, there are some shops, some different boutiques, some thrift stores, and basically I just wanted to like find local shops that can fit into any budget of like what people need. So you can see different boutiques and everything, yes. Okay, let me go back to my slideshow. Okay, next slide, please. And then here are my cited sources. Most of these are just like different environmental articles and other stuff like that. Yeah. Okay, thank you. Next slide. And then thank you guys for listening to my presentation.
Hello, everyone. Hello, everyone. My name is Swesha, and my presentation is on improving diabetes health outcomes in South Asian communities. The issue is that South Asians are disproportionately affected by diabetes and have the highest prevalence in the US compared to any other racial or ethnic groups at 27% versus 7% for whites and 15% for Hispanics. So this is shown in this top right graph right here, and which compares white European, Pakistani, and Indian groups' body mass index. As you can see, the curves representing Pakistani and Indian groups are rising at a much faster rate compared to white European, meaning that they face the same type of risks and prevalence of diabetes, but at a much lower body mass index, and which puts them more at risk of health complications such as heart failure, kidney failure, and liver disease from poorly managed or untreated diabetes. Okay. So my solution for this is to implement more free community-based education and screening programs at South Asian community events or places of worship like temples. So the education workshops would include diabetes risk factors and prevention, self-management strategies to lower blood sugar levels at home, and nutritional education that's still culturally relevant, and all of this would be provided in multiple different languages. And also connect community members with healthcare resources and services. So this would be an effective solution because educational awareness of risk factors promotes earlier diagnosis and treatment and improves diabetes self-management and blood sugar control. This is shown in this graph right here, which shows two groups, one that received health education and one that didn't. And over time, the group that did receive education showed better blood sugar control and blood sugar levels that were at the right level, and proving that diabetes health education helped patients manage their diabetes more effectively, and they were able to reduce risk of long-term health complications. And these are all the sources I used. Thank you for listening.
Okay, so hi everyone, my name is Nila, and I did my project on childhood obesity. So what is childhood obesity? Childhood obesity is a medical condition in which a child has an unhealthy amount of body fat for their age and height. Childhood obesity increases the risk of serious health problems such as type 2 diabetes, high blood pressure, heart disease, sleep disorders, and mental challenges later on in life. So what is happening in our county? So although there are many health resources, childhood obesity continues to affect thousands of children, especially those living in lower income communities. Limited access to fresh fruits and vegetables, the high cost of nutritious foods, increased consumption of processed foods, and lower opportunities for physical activity all contribute to higher obesity rates. Children from families facing food insecurity often rely on inexpensive, highly processed foods that are high in sugar and unhealthy fats. This shows that childhood obesity is not just about individual choices, it is also influenced by access to healthy resources and community support. So, when I was doing my research, I found out that 36.5% of fifth grade students in Contra Costa County were overweight. This means that 1 in every 3 fifth grader was affected. And among those fifth graders, 40.1% were boys who were overweight compared to the 32.8% of girls. And for older students, 36.5 of seventh graders and 33% of ninth graders in Contra Costa County were also overweight or obese, showing that the health issue continues throughout adolescence. Obesity is closely linked to nutrition, food access, and socioeconomic factors, making it an important public health issue that requires community-wide solutions. So for my solutions, I first was decided upon increasing education and awareness that could be done by partnering with child care centers, preschools, schools, and pediatric clinics to hold monthly nutrition workshops for child care providers and parents, providing healthy meal plans and grocery guides, recipe books, and nutrition toolkits that teach balanced meals, portion sizes, and healthy snack options. That would just create, and just overall creating a county certification program that recognizes child care providers who meet the healthy nutrition standards for kids. And then also holding countywide healthy food drives that only consist of fruits, vegetables, and just foods that are highly dense in nutrition and have little to no junk food present so that the kids can have the nutrition they need. And then improving access to healthy foods. So there should be more funding for meal pass cards for low-income families who can have it to go to farmers markets or go to grocery stores that have better nutritional food available. And then finally, there should also be there should be an investment in a healthier community, which would include having funding for gardens, nutrition education, and safe spaces for children to stay active. And this would also include having more farmers markets present in rural areas or just in the county overall. And then there should also be partnerships between schools, local farms, healthcare providers, and community organizations to make healthy living more affordable and accessible for every family. These are my citations. Thank you everyone for listening.
Hi, my name is Michelle, and today I will talk about the prevention of anxiety in young people. Next slide, please. My issue is anxiety among teen and young adults. Anxiety is one of the most common mental health conditions, especially between the age of 15 and 25 years. Many young people do not get the help they need because mental health services are expensive, hard to access, or they fear to begin judged. Anxiety can affect school performance, relationships, sleep, and everyday life. Around 1 in 3 teenagers experience an anxiety disorder before adulthood, showing why it is an important public health issue. And the right side is a chart that shows that anxiety and depressions are in the top of the list of problems in teenagers, with 70% more than other issues in young communities. Next slide. Uh, Solution. My solution is called the Resilient Hood. It's focused on preventing anxiety instead of only treating it after it's become severe. The program includes a Shadow Guardian and a tool that recognizes early signs of stress and offers immediate support. Provides the compression pad. This is a place where students can take a breath and calm down. And last, weekly neurohacking workshops that teach healthy coping strategies. Together, these resources help young people build resilience and improve their mental health. Next slide. Implementation. To make this program successful, we need support from different partners. Schools and community centers can provide a space for the compression pads and workshops. This will be the key point since it is where the teenagers are most and where they can attend regularly and receive help on time and prevent issues. Work hand in hand with the state's mental health programs like the Children and Young Behavioral Health Initiative or the California Health and Human Service Young Mental Health Resource Hub, so that they support the program and provides training to people in schools and community centers. Government fundings and grants can pay for counselors and AI tool technology support. Next slide. Uh, the Resilient HUD impacts. The goal of the Resilient HUD is not eliminate anxiety completely because everyone experiences stress at different times in life. Instead, it helps young people recognize anxiety early, manage in healthy ways, and build skills they can use throughout their life. And this program offers early support, safe space, and practical coping strategies. Students can improve their emotional well-being, success in school, build healthier relationships, and become more resilient as an adult. And next slide, please. And there are my sources. And next. And that's it. Thank you.
Okay, so my topic is on the invisible threat, infections in newborns, which is called neonatal sepsis. It's a serious infection that affects newborns during their first 28 days of lives, and I will be presenting. Okay, so for my issue and data, the issue is that neonatal sepsis is a serious infection that affects newborns during their first 28 days of lives. It can affect their lives and it can become life-threatening if it's not treated quickly. This mainly affects newborn babies, especially premature babies, babies in the NICU, and babies with low birth weight. For my data, about 3 million newborns develop neonatal sepsis each year, and it contributes to about 15% of newborn deaths worldwide. So down below, the map shows neonatal sepsis date rates by country in 2023, where the darker areas show the higher mortality rate. So for my upstream solution, I decided improving prenatal care and parent education. So by this, we educate the parents before birth, where families can learn ways to reduce infection risks and provide safer care for their newborns. This includes regular prenatal checkups, proper hand washing, keeping the baby's environment clean, and recognizing early signs before any infection. So why is my solution effective? Well, I think my solution is effective because it focuses on preventing neonatal sepsis before it even happens. So education helps the parents recognize infections earlier. Prenatal care helps identify the risk, and prevention methods like hand washing can reduce the spread of harmful bacteria. So these are my cited sources that I used when I was researching. And thank you. I made this really quick because I know we're running out of time. So sorry for rushing, but thank you.
Good afternoon, judges, and also audience. My name is Maame-Abena Dwumfuoh. My pronouns are she, her, and this is my presentation called Breaking Barriers, Health Access for Disabled Youth. So to start off, the issue that I came up with is disabled adolescents face transportation barriers that limit access to healthcare resources. And the outcome that I'm trying to prevent is disabled adolescents experience delayed diagnosis. And the data I have to support this is about 7% of adolescents with disabilities reported having trouble getting the needed transportation. More than 3.5 million US residents, including teens, forego medical care each year due to transportation barriers. And according to the Centers of Disease Control and Prevention, individuals with disabilities often report poor overall health compared to those without disabilities. And all of these data facts are all based on adolescents that are 13 to 18. Okay, and now presenting my upstream solution. The solution that I came up with was a website called the Digital Health Passport, and this is a free website designed for disabled adolescents. My plan is for this website to be kind of implemented during middle school and can be used during college as well, where they are able to find free or low-cost transportation options to nearby clinics, as well as schedule rides through partner transportation services such as the ADA paratransit and also Access for All program, which are all stated or funded by California, as well as receive reminders for upcoming appointments as well. So if you do click here, which should bring you, yes, okay. If you click here, it brings you to the mock-up design that I made for this website, where it has a passport progress, the upcoming appointments, and the ride to the appointments. But I feel like something that can be kind of seen as cool is that, oh, sorry, I don't know why something that can kind of seem as cool is that there is like an incentive to using this website, which is my rewards. Um, Basically, when you use the website, you can collect something called passport points, and from there, adolescents are able to kind of redeem vouchers to restaurants and also movie tickets as well. So, okay. And I think this will be an effective solution because it not only reduces transportation barriers, which makes it easier for adolescents to attend these healthcare appointments, because it kind of collects all transportation or also transportation that is funded by California to be able to kind of put it in one place that is very easily accessible. But it also encourages regular preventative care through reminders and also organized health records as well through the reminders, and also that like the ride is there or the appointment section as well. And then my third reason is because the gamification of the website increases the engagement by rewarding adolescents for taking steps towards better health as well. I feel like in this day and age, especially from my experience, I realize a lot of adolescents my age really do like games, and I feel like kind of having this reward incentive towards the project kind of helps them be more engaged and use the app more often as well. So, and these are my cited sources. Thank you so much for your attention. Any questions?
Okay, hello, my name is Celia Roe, and I'm going into my freshman year of college in the fall, and this is my project on bridging the language gap in women's healthcare. Next slide, please. So who does this language gap affect? Well, women with limited English proficiency, such as Spanish speakers, Chinese speakers, people who speak Tagalog, Arabic, and many other languages and dialects, as well as the general community members. And why is our language gap such an issue? Women historically have been overlooked because of research gap and gender bias, so adding a language barrier on top of that leads to increasingly constrained communication with their providers and makes it harder for them to access available resources. And although translation services are available under laws such as the Affordable Care Act, they're not always timely or equitable. They often don't take into account digital literacy or require like five business day notices for in-person translation. So patients who are in acute condition experience delays in care or end up just going undiagnosed for months on end. Next slide, please. To illustrate this issue, I've chosen a quote from a woman who has participated in a study on the relationship between LEP and healthcare, where she went without translation services. So she was waiting for 3 months without care because she could not rely on anyone else. to translate for her in those settings. And in Contra Costa County specifically, a whole 8% of residents have limited English proficiency and are only Spanish speakers. And 8% might not seem like a lot, but that's thousands of people, and those thousands are just Spanish speakers. So there's lots of other languages that this involves. Next slide, please. So to solve this issue, I propose No Women Left Unheard, which is a multi-part equitable initiative that gives women with LEP resources, knowledge, and support to ensure they receive the high-quality care that they deserve. The first step of this is to hire a cultural advocate team of translators and educators. They'll be hired from the medical translation field, education field, and as well as students who are in language classes, or have the seal of biliteracy or involved in multicultural clubs. And these multilingual members will go to hospitals, clinics, schools, and community organizations to spread the mission of upkeeping high quality care for women with LEP, as well as make sure they're allowed in those spaces. And cultural translators will assist in health settings, as opposed to medical translators who act as the liaison between patients and doctors. The cultural translators will ensure the patients fully understand the treatments available, what treatments entail, and help navigate health decisions. And cultural educators will partner with community organizations as well as schools to teach health equity. So making sure women with LEP understand the laws that they're entitled to and resources available for them before they even go into the doctor's office. And some partnerships can include the Safe Center, which works with undocumented people, the Contra Costa Commission for Women and Girls, as well as Contra Costa College, which hosts a lot of adult ESL classes. And the fourth step is just to monitor the progress to making sure that we're constantly improving the project. Next slide, please. The solution would work innovatively and effectively because it is accessible to the target population. Those community organizations, as well as schools, are places that the target population interacts with and trusts, so we can prevent health inequities before they happen. And youth involvement is a big part of thinking upstream, because if the youth are knowing what issues they face in healthcare, they can help prevent them and spread the word. And it confronts systemic power imbalances that exist between men and women, doctor, patient, etc. And it gives voice to underserved populations. Healthcare is such a diverse system, and it should be worked with the diversity in mind. So making sure that that sense of belonging is given to women with LEP is exceedingly important. Next slide, please. And here am I, we're excited. Next slide. Thank you so much. And I'm open to any questions.
Hello, my name is Valeria Lugo. I am now officially a senior at Liberty High School, and today my presentation will be about affordable healthcare in the Latino community. So, next slide, please. So, first of all, I was able to find a direct acronym to find out what the Latino community in Contra Costa County is, and I arranged it with the acronym LUNA, low income families that are uninsured or underinsured with no job benefits and an annual income below $100,000. Next slide, please. So, during my research, I was able to come up with a few estimates based on the HR 1 Act that recently went into effect this year, and it estimated that by 2029, 93,000 Contra Costa County residents with medical coverage and dental benefits will end this by the end of this week, actually. And over 10,500 undocumented residents have been placed under basic healthcare program, meaning that any other needs such as a broken arm, any terminal ill diseases, they will not be able to get treated as effectively because they are on the basic healthcare program, meaning that pressures will continue to rise among the community for a higher demand in healthcare. Undocumented adults of 19 years or older can no longer enroll in Medi-Cal, and that went into effect beginning of this year on January 1st, 2026. And 500 million federal and state cuts will be made through 2031 following these numbers. Next slide, please. So my solution was I was not able to place the acronym as well, but I came up with the acronym Project HEAL, which stands for Health Equitable Association League. And it basically will rewrite the eligibility criteria, but also engage one-on-one sessions with students in other schools and other public spaces. As you can see by the charts, these were photos I had to be taken. I don't know if you can zoom in, but if you can, there are some standards that, based on my resources, I was able to find, such as the fact that on the chart to the right, the white chart itself, uh, s- Hispanics, undocumented or residents, cannot pass the 200%, but white residents or blacks or Asians can, mainly because although those are minorities, the real hard work is done by Hispanics. And because they are seen as the main minority, as you can see with everything happening with the ICE deportations and all that, it has become an extreme demand for Hispanics to better their residencies, get their green cards for their Medi-Cal, etc. Next slide, please. So what Project HEAL is supposed to do is they will associate themselves with parks, schools, public spaces, libraries, anywhere that they can find for community-based orientations, where they will educate healthcare where they will educate adults and children about healthcare, and this will be this I suggest this I place that they should also be a program or a class for high schoolers, because they are still in their developmental phase. And alongside of that, there are also many pathways in high schools where medicine is applicable. So I feel like this will be a great program for them to understand how healthcare applies uh, to all aspects of their pathway. Next slide, please. This works because it will form a better informed society with more confidence. Teens and families will have safer spaces and will provide a sense of community. Project HEAL is also supposed to provide cultural language classes where people will have less cultural barriers and understand what affordable healthcare means and how it can be more accessible, even though they are of low income, as most families are. Next slide, please. These are my sources, and questions are welcome. Thank you.
Hi guys, my name is DeAna Armstrong and I am a rising senior at DeAna High School. And today my project will be the lack of sanitation and homelessness. Next slide, please. So the issues I am trying to address are just the limited access to safe housing and sanitation for homeless people, and which kind of affects like the encampment locations that they locate themselves to near local waterways, and they don't know the effects that they have on the environment as well as themselves, the health risks that they expose themselves to. Next slide, please. So the first piece of evidence I found was from the 2026 Contra Costa County point in time count, and around 2,300 people are experiencing homelessness in the county as of 2026, and 58% of them are living outside in tents and in the outdoors. So where are these unsheltered people going? They're most likely going to streams just because they're out of sight and out of mind, and they're out of sight of law enforcement and the stigma of the public. And what's happening when they go to these streams and creeks are that they're exposed to unregularly monitored water and untreated environments and polluted water, as well as human pathogens and different diseases and skin infections. And the image on the right is actually from a stream that's near my internship location. And we kind of just went over there and kind of talked about some resources they tried to kind of just bring up to kind of prevent this kind of from happening. And I just took that picture because I knew I kind of wanted to do my project about this. So yeah, next slide, please. So the solution I want to propose is a program called Waterways for Wellness, and each target area in the county would have hubs with portable restrooms and wash services, trash and recycling bins, cleaning services, water quality testing, and mobile healthcare vehicles. And an outreach team would dedicate their time to connect people with long-term shelters, housing, healthcare, and employment services. Next slide, please. This program is effective because it increases access to necessary sanitation, which decreases exposure to disease and infections. There will also be reductions in unsafe encampments due to more shelters being provided and more safer areas being available for people who can't get access to shelters. And also there will be more chances or more employment opportunities and sheltering opportunities, as well as it promoting environmental cleanliness and more environmental health, as well as public health. Next slide, please. These are my sources cited. Next slide. Thank you. Any questions?
Hi, my name is Avneet Kaur, and today I will be discussing eczema's impact on mental health in communities. Next slide, please. So the issue that I want to discuss here today is that people who struggle with eczema tend to experience more anxiety, low self-esteem, and feel more isolated because of their skin condition. This matters because mental health can have a huge effect on your well-being. For example, if mental health is disrupted, then it can affect learning, your sleep, and your confidence. In this data that I found about the mental health burden of teen eczema, I found that those that deal with eczema have a 30% higher risk of depression, a 40% higher risk of anxiety, and up to 60% of people that do deal with eczema also experience sleep disruption, which from personal causes I can tell that's true. And treatment does help, though it is a temporary effect. It's not forever. Next slide, please. So my upstream solution here is, what should we do? I think that we should teach students about eczema in schools. And going further into that, I think schools should teach students about eczema and generally all skin conditions, as well as even consider opening up a dermatology class so people can learn more about what eczema really is. Learning about eczema would help students understand what causes it and how it can affect people's daily lives. This education could reduce misunderstandings and bullying while encouraging empathy for classmates with skin conditions. It would also show that eczema is more than just a skin problem, as it can affect a person's confidence, mental health, sleep, and overall well-being. So by increasing awareness in schools, schools can help create a more supportive and inclusive environment for those that deal with eczema. And if teachers were to teach this, I think they should teach what eczema is, its effects on mental health, what it can be like for those that deal with it, and if any tips or tricks to deal with eczema, that'd be helpful too. Next slide, please. My solution's effect. So my solution can be effective because when schools teach about eczema and how it can affect mental health, it can reduce bullying, increase understanding of people with skin conditions, create a more supportive environment where students with eczema feel more accepted and comfortable, and improve their emotional well-being as well as lower stress and anxiety. And as a result, students with eczema would be able to focus better in class because they would be less distracted by any discomfort or fear. They would also feel more confident participating in class discussions, group activities, and school events. With a more supportive school system and environment, they could improve their grades, build stronger friendships, and have a more positive outlook on school in general. Next slide, please. These are my cited sources. Next slide. And thank you guys for listening. Any questions?
My name is Leah Santiago, and this is my presentation about breaking the cycle. Next slide, please. Yeah. For my issue, I chose to focus on how parental ignorance affects their child's mental health. My issue strongly impacts adolescent teenagers because during teenage years, the social world and relationships with parents undergo the most transformation in a person's life. I want to prevent future children from suffering mentally, emotionally, and to prevent damage because of their parents' parenting styles. Next slide, please. 26 of parents use an authoritarian style, which is all about being strict and stern. They insist on unquestioning obedience and enforce their roles through psychological control, threats, and shaming. The child may grow up to be aggressive, shy, unhappy, and have low self-esteem. Additionally, they may also perform poorly and rebel in school. 10% of parents use neglectful demands on their children. They also generally provide little support and attention. A child growing up this way may experience a difficulty controlling their emotions and a difficulty developing social and emotional relationships.
If I were to create a solution, I would want upcoming parents to attend mandatory classes that would be focused on current issues that kids and teenagers struggle with. I would want it to be run by Gen Z because I believe that the teachings would be taught would be as accurate as possible since Gen Z has lived through those struggles. Gen Z also has more access to current resources that distribute mentally and scientifically accurate information. Next slide. This is innovative because it introduces parents to different perspectives on raising children and moving them away from outdated methods of parenting. It also flips the dynamic of instead of the older generation usually teaching the younger generation, it's the younger generation teaching the older one. This is effective because it gives Gen Z a voice in shaping family dynamics and presenting their understanding of mental health and their perspectives. With Gen Z being the teachers, it stops generational trauma by, and I quote, breaking the cycle. Next slide, please. And then these are my resources that I use. And thank you.
Hello, everyone. My name is Luna Vasquez, and today I'll be presenting my project, Preventing Illegal Trash and Hazardous Waste Dumping. Next slide, please. To start off, I just wanted to say, I chose this topic because illegal dumping is something I see in my own community. If you just drive down the street, you'll see a bunch of piles of trash and just people throwing trash outside their window. And so I knew that if you clean it up, it doesn't solve the problem because I have personally gone to cleanups and nothing has, it's gotten worse. So I started to think, and I was realizing that also household hazardous waste, there's not really a lot of information about how to dispose of it, like batteries, electronics, and paint. So I was thinking that there should be more information on how to do it. So my issue in data is that illegal trash dumping and hazardous waste pollution are harming the neighborhoods in Richmond and El Cerrito. Illegal dumping can contaminate soil and water, attract pests, create safety hazards, and lower the quality of life for residents. This issue is unfairly impacts neighborhoods where illegal dumping happens the most. According to Contra Costa County, Richmond had over 5,800 illegal dumping reports in 2025, making it one of the county's biggest dumping hotspots. Hazardous household waste such as batteries, paint, electronics, and pesticides can also pollute the environment and harm people and wildlife if it isn't disposed properly. These facts show why preventing illegal dumping is so important. And then on my slides, it's just a table that I found that shows kind of all the information and then also some dumping hotspots. Next slide, please. My upstream solution focuses on preventing illegal dumping instead of only cleaning it up afterwards. I propose increasing hazardous waste collection events, installing more public trash and recycling bins, and educating residents about proper waste disposal at the environmental impacts of illegal dumping. By making this disposal easier and helping people understand the consequences of illegal dumping, we can reduce the amount of waste that ends up in our communities. Next slide, please. Okay, why my solution is effective? My solution is effective because it addresses the root causes of illegal dumping instead of only treating the symptoms. When people have better access to disposal services and understand why proper disposal is important, they're more likely to make responsible choices. My solution is also equitable because it benefits everyone while providing additional support to neighborhoods that experience higher rates of illegal dumping and fewer disposal resources. Preventing the problem before it starts can create cleaner and healthier communities for everyone. Next slide, please. These are my cited sources. Next slide, please. Thank you. Any questions?
Hi, everyone. My name is Elianna Ortiz. I'm an HCP summer intern. I'm an incoming senior at College Park High School, and my presentation is on improving mental health through art and a solution I call Project One Project. Next slide, please. These are the data levels of poverty in two cities only 20 minutes away from each other, Antioch and Walnut Creek. Studies show that teens in poor cities, for example, Antioch, are less likely to ask for help than teens in rich cities such as Walnut Creek because they don't want to worry their parents with having to pay money for them to get help. According to Winona State University, teens and children from poor cities will be 3 times more likely to develop mental health problems than teens and children in rich cities. However, it doesn't have to be this way. Next slide, please. There are many nonprofit organizations in Contra Costa County which strive to better the mental health of teens free of cost. However, there are so many teens who don't know these resources are available to them. We can lower the risk of mental health in poor cities without any funding necessary. All we need to do is let students know about these resources. Informing students in Contra Costa County high schools that these resources are available to them is essential. However, just informing them isn't enough. 33% of students who are struggling don't want to ask for help because they're embarrassed. Since students from cities like Antioch are 3 times more likely to develop a mental illness than students in cities like Walnut Creek, let's start in Antioch. Next slide, please. Solutions that currently exist are basic. Realistically, passing a pamphlet around or giving another lecture won't really stick in students' heads. Everyone loves art, so if every single high school in the Antioch School District requires that art classes have one project addressing the issue of mental health once per school year. This includes drawing, theater, choir, and more. Once art students have created their project, there will be a designated day at every high school for students to showcase their project. This will take place in the courtyard quad or open space of each high school during lunch, so it's impossible to miss. With the theater performing and paintings to browse while watching the performance, students will be drawn to the unusualness of the event. Once they realize mental health is more common than people make it seem and is not something they should be embarrassed or ashamed about, they will want to get help, and a designated speaker at the event can give students who are curious any more information they need on the nonprofits that help teens free of charge and how to contact them. This solution should have a partnership with the Antioch School District so that they can set these requirements for art classes in place. Next slide, please. Why it's effective. People can express their artistic side in many different ways: painting, music, dancing, theater, and so many more. Art has always been the key to bringing people and cultures together, so art can bring awareness to mental health too. If more students are less afraid to speak up and ask for help on their struggles with mental health by starting in a poor city of Contra Costa such as Antioch, that means we can lower the data of poor cities being at higher risk of mental health issues. This is a list of all the nonprofits near Antioch that help anyone struggling with mental health for free: Village Community Resource Center, Contra Costa Crisis Center, Rainbow Community Center, Family Justice Center, Healthy Contra Costa, People Who Care, and Women's Cancer Resource Center, which helps people who are struggling when recovering with cancer. Next slide, please. I use 2 websites from World Population Review for my data on Antioch and Walnut Creek, as well as an article from Winona State University and youngminds.org. Next slide, please. Thank you for listening to my presentation. Do you have any questions?
Hi, my name is Cathlien Orcino, and today I will be talking about no smoking policy around school. Oh, next, yeah. This topic caught my attention because smoking has become more normalized, and cigarettes are like easier to access. Kids and students are easily influenced by what they see, and when they see people smoking near schools, they may think it's normal and want to try it. Smoking can cause serious health problem. It can also affect their brain development and can cause problems later in life, which is why I support a no smoking policy near schools. And then, as you can see, here we can see a chart showing that smoking among high school students is increasing. The black line represents cigarettes use, while the yellow line represents e-cigarette use, which has been rising rapidly. Next slide, please. Thank you. My upstream solution is illegal to smoke or vape within 500 to 1,000 feet of all schools, playgrounds, and youth centers. If you guys are wondering what 500 to 1,000 feet of feet, how far it is to from you or so, it's about 5-minute walk. So it's not that far, but it is pretty far for some students or for school. And then having regular patrols and using fines to people who smoke or vape near schools property to and then the other one is to strengthen local ordinance that keeps school environment free from tobacco vape and cannabis smoke, and then teach students about the health risk of smoking and vaping before they start, so they can know how bad smoking is and how it can affect them in the longer run. Next slide, please. Individual behavior or response. Young people are less likely to try cannabis or become regular users because they have less exposures and fewer opportunities to use it in public. Adults who use cannabis are encouraged to smoke only in places where it is allowed. Next slide, please. Health outcome. Lower risk of cannabis dependence among youth, fewer health problems from secondhand smoke, healthier brain development for young people, and improvement overall community health. Next slide, please. And then the no smoking cannabis policy helps protect students by keeping cannabis smoke away from schools. It reduces secondhand smoke and makes cannabis use less visible, helping young people avoid seeing it as normal. This supports healthier school environment and lower the risk of used cannabis. Next slide, please. And then the next slide is just my resources.
Hi, everyone. My name is Shaianne Arcinas, and my presentation is about maternal health, the importance of early prenatal care. And pregnancy is an important time when mothers need access to health care, education, and support. However, many pregnant women do not receive prenatal care early enough, which can increase health risks for both the mother and the baby. And my project focuses on improving maternal health by creating free community prenatal education programs that help women learn about healthy pregnancy habits and connect them with healthcare resources. Next slide, please. Why maternal health matters. Prenatal care is prenatal care is the medical care a woman receives during pregnancy. These visits are very important because they allow healthcare providers to monitor the health of both the mother and the baby, and they identify possible complications early and provide guidance throughout pregnancy. When prenatal care is delayed, problems that could have been prevented or treated earlier may have become more serious. And this issue is important because a healthy pregnancy does not only depend on medical treatment after problems occur, it also depends on prevention, education, and making sure mothers have support from the beginning. Next slide, please. Who is affected? The population impacted by this issue is pregnant women, especially first-time mothers and women ages 15 to 44. And according to Centers for Disease Control and Prevention, CDC, in 2024, about 75.5% of pregnant women began prenatal care during their first trimester, which means that while many women are receiving early care, there's still a significant number who are not. And additionally, 7.3% of mothers received late or no prenatal care at all, meaning about 1 in 14 babies were born without early medical support. And these numbers show that improving access to early prenatal care is still an important public health issue. Next slide, please. So why do some women not receive prenatal care early? There are several barriers that can contribute to this problem. Some women may not know the importance of early prenatal visits or may not know where to access resources. Others may experience challenges such as transportation issues, financial concerns, lack of healthcare access, or not having enough support during pregnancy. Because these barriers happen before health complications occur, addressing education and access is very important to step toward improving maternal health. Next slide, please. My upstream solution is creating free community prenatal education classes. These classes would provide pregnant women with information about nutrition, exercise, healthy pregnancy habits, and the importance of prenatal appointments. And the program would also help women schedule healthcare visits, connect them with local providers and community resources, and creating peer support groups, especially for first-time mothers who may feel unsure or overwhelmed. And the goal is to make pregnancy resources easier to understand and easier to access. And the benefits that come along with it is that it not only addresses the root causes by focusing on prevention, instead of waiting until pregnancy complications happen, education can help women make healthier decisions earlier on and encourage them to seek medical care on time. By connecting mothers with healthcare providers and support systems, this program can increase confidence, reduce barriers, and creating healthier outcomes for both the mother and the baby. The main idea is that early education and support can lead to healthier pregnancies. And next slide, please. Equity and vital conditions. This solution also supports health equity, and because it provides free education and resources to pregnant women regardless of their income or background, it connects to several vital conditions for health, including humane housing and transportation by helping women access healthcare services, lifelong learning through pregnancy education, basic needs for health and safety through healthcare connections, and belonging and civic muscle by creating support networks. Every mother deserves the opportunity to have a healthy pregnancy with the knowledge, resources, and support they need. And next slide, please. And these are this is my side work and what I use for this presentation. And thank you. Thank you for listening. And any questions?
Okay, hi everyone. My name is Jeimy Molina, and today I will be talking about the impact of farm workers and one of the biggest challenges they face, which is the shortage of healthcare workers. I will also explain how this affects farm workers' families and some solutions that can help. Next slide, please. Okay, for this second slide, I have the issues for farm workers and their children. So farm workers' children face many challenges because of the type of work their families do. Many have trouble getting into healthcare. They also miss school. By what I mean by missing school is like, for example, farm workers, they don't stay in the same place. They usually move to like different cities or different states. Because it depends like where the fruit or the vegetable is growing. So their kids have to like, keep moving states like every once a month, pretty sure. And like they don't get to like experience like friendships or like learn English or any type of other language. Also like farm workers deal with like challenge barriers, like basically more about education and future opportunities for their kids and themselves. Next slide, please. Okay, one way to improve this is by bringing more healthcare workers into rural communities. The mobile health clinics can travel directly to farms, and bilingual health career workers can make it easier for families to communicate and receive the care that they need. Because usually farm workers, sometimes when they don't have papers or documents, they don't get like qualified, so they're not able to get the help that they need. And I just feel like it's not fair because everyone needs like help on everything, especially if it's about your health and about like receiving help for their kids as well. Next slide, please. And then this solution is important because it helps farm workers get checkups treatment before it becomes serious. It also helps solve the healthcare work shortage, supporting children of farm workers and who wants careers healthcare. So basically, like children of farm workers that are invested in health career deserve the support and mentoring like health career pathways and scholarships to become the next generation workforce. They know that the challenges and can be trained to improve excellent care that farm workers deserve. Next slide, please. This solution works because it works healthcare closer to where farm workers live and work. It reduces long waits times, improve communication with bilingual providers, and helps prevent idleness before they become emergencies. And next slide, please. And then these are like my resources where I found information. This is like how I did my presentation. I went to those websites and like look for it and research like every like detail about it. And I also learned about like where I was working at, which is the Hijas del Campo. I learned many things by seeing it and also like by hearing from them, like what their farm workers go through. Next slide, please. And thank you. And hopefully you guys enjoy my presentation about farm workers and their families. And do you guys have any questions?
Yeah. Hello, my name is Melanie Hernandez-Rios. My pronouns are she, her, and I'm going to be exploring the topic of substance use disorder, otherwise known as SUD, in youth at non-traditional schools specifically, which can be either continuation school, special education school, or homeschooling. Next slide, please. So the data says that the more ACEs that you have, which were adverse child experiences, the more likely you are to be using one of the drugs in the top graph right there, which is alcohol, cannabis, tobacco, and other drugs that are not shown. So the data on the bottom graph right there shows that non-traditional schools have way higher rates of drug use as opposed to just regular education schools. And in 5 non-traditional schools, a research showed that 96.4% of students reported at least one adverse childhood experience, while 74.4% reported 4 or more, which is above average. And the national survey shows that one ACE risks your absenteeism chances by 2.5%, no, 2.5 times, and 3 or more ACEs can raise it by 5 times as much and raise behavioral problems by 6 times as much and academic failure by 3 times as much. Next slide, please. So for some background context, what is adverse child experiences? So right there in the middle of the screen, there's a list that shows you what examples of that could be, which is physical abuse, emotional abuse, sexual abuse, physical neglect, etc. And these can lead to negative health consequences. Like the graph shows, the more ACEs you have, the higher your health risks are. And it leads to substance use disorder, which is using drugs, anxiety, or depression. And there's a direct tie from depression and substance use disorder to dropout rates in high school. And non-traditional school students in a single parent household or with poverty have increased risk of ACE, which means they're likely to be less healthy. And due to these students having a lack of mentoring, financial hardships, mental disorders, and less opportunities in general, they are at higher risk of coping with substances. Next slide, please. So for my upstream solution, I called it the Hobby Hatcher. And what this does is partners with specific companies like around your city, could be gyms, dance studios, yoga studios, photography, art class, music lessons, and a lot more. And what this does is it funds activities for students in non-traditional schools from 8th to 12th grade, since we did see that big jump in SUDs from 7th to 9th grade. And it gives them something to resort to that gives them that same positive activity that isn't substances. And how do they get into this program, you may ask? Well, they can be referred via a monthly 2-minute mental health survey that they will be completing online, and then people who read the forms can then decide whether to put them into this program, or a family member or staff member can refer them to them. While non-traditional schools who are more at risk can automatically opt in and be into the program. Some barriers to this solution is that transportation to and from activities can be difficult to arrange because sometimes there isn't bus routes, sometimes it can be harder to get them passes, or it could just be really far away. Next is expenses. Even at discounted prices, memberships for these gyms or studios can be expensive, and negative stigma because people can have a feeling, oh, why did I get referred to this program? And maybe they don't want people to know that. So negative stigma is a big thing. And lastly, less opportunities to rural areas who may not have these activities nearby. Maybe they don't have sports clubs or sports teams nearby. And for the closing statement is that hopefully this will give them a non-substance rewarding activity. It will reduce the risk of using substances to cope, and it will lower the substance use disorder rates in youth. And then, therefore, there will be less health risks for them. Next slide, please. Here are some of the references that I use, which are some from universities, hospitals, or national surveys. Next slide, please. And thank you for listening. Does anyone have any questions?
Hi, my name is Samson Situ, and I'm presenting about anaphylaxis recognition in public schools. Next slide, please. So the reason why I'm presenting this is because in high school I had an allergic reaction that I did not know that to something that I did not know I had an allergy to. So so it was like a traumatic event that happened, and I was rushed to the ER, and I had to have EpiPen or epinephrine administered to me because I was in life-threatening conditions. So EpiPen or Neffys are often at schools or at almost every site uh, and are also carried uh, by people like me who, if you can see, uh, to prevent or treat in case of allergic reactions. And they narrow blood vessels to increase blood pressure and relaxes muscles, which opens airways, which is often the symptoms of anaphylaxis shock. Next slide, please. So the issue is that public schools are not prepared enough to deal with students having an unexpected allergic reaction, and it always requires a quick response to avoid life-threatening conditions. And this statistic right here is from EpiPen, or a program that provides EpiPen to schools, and 6,000 schools has around 6,000 schools reported around 1,000 anaphylactic events, and which means that so many allergic reactions has happened and must be addressed with EpiPens or going to the ER. Next slide, please. So here's my data, and a very important data is that 25% of allergic reactions occur in those with no known allergies. So these students and 25% of these allergic reactions in these individuals do not know how to use an EpiPen. And they and at those schools, California's schools may not have a school nurse that can recognize or provide treatments to students in case of emergencies, especially in under-resourced schools. Next slide, please. And the solution that I propose is that to have a program where qualified educators comes into each period of a science class annually to teach students about recognizing and treating anaphylaxis. And this could help students and staff and teachers know when they're having an allergic reaction within themselves or within peers, and know where to locate EpiPens or Neffys in case of emergencies. And schools could also have be provided school nurses, especially in under-resourced schools, because it could help in educating or providing medical care and attention quicker and more responsively in case of emergencies. Next slide, please. Plug in my PC. Here's some of the resources I use, and next slide, please. And thank you.
This is my HCP final project, and it is called Deeper Than You Think. Next slide, please. Shining light on the issue. Many people don't know about the true effects of racism and racist media in America. In American media, it has very racist depictions of all people, but one group that has the short end of the stick is African Americans. African Americans have some of the highest incarceration and unemployment rates in America. These negative outcomes are often linked to poor media portrayal and stereotyping of African Americans. Next slide, please. Examples and stats. There are a lot of statistics showing how in the healthcare and the job system, there are a lot of struggles. One example of this would be the Central Park 5 case, where 5 young males were taken into custody and not given a fair trial. They were guilty without any evidence and were held in prison for 6 to 13 years until the real confessor came forth with DNA evidence. And in the healthcare, Black maternal and mortality rates are higher than any other race. This has been attributed to biased care recommendations during parental care and during active labor. Studies also show that future nurses in Harvard also believe myths and urbans about Black people and their pain tolerance and their nerve receptors, which is not true. And when it comes to job struggles, African Americans continue to have some of the highest unemployment rates, and it is shown that applicants with Caucasian-sounding names are 30 to 50% more likely to receive callbacks. Next slide, please. An upstream solution to disrupt this implicit bias: investing in media literacy programs and making it a part of schools, collaborating with the FCC, using broadcasting guidelines, and not using AI when it comes to look for employees. Next slide, please. Why is this solution effective? This solution is effective because it teaches students and the younger generation to challenge racial stereotypes, and especially media, through a critical lens. It encourages Black students to pursue careers in health, media, and law. It also represents a leadership as well. It strengthens broadcasting standards with the FCC, oversight to promote fair and accurate representations of all groups. These solutions improve health and employment opportunities by reducing harmful stereotypes and expanding career pathways. Next slide, please. That is it for my presentation. Are there any questions?
So, hi everybody, my name is Gabby, and today I'm going to be presenting my presentation, and it's called We Need Buddies Too, and it's specifically for 12 to 17-year-olds in West Contra Costa Unified School District, and it's for equitable social health solutions for teens in need of help. Next slide, please. So what's the main problem? So I've noticed many students, especially at my school, that they lack connections with their peers, and they see that having their educational life and their home life seen as bad, since they don't have a good school life. They kind of take that home and isolate themselves, and overall not having a safe environment to learn or to be with people around them. Next slide, please. So here's some data that I found in West Contra Costa County, and here you could see that many students, especially in the West Contra Costa County Unified School District, have reported decreasing mental health due to bullying, anxiety, depression, mostly peer pressure. And so many of the students need their friendships, and many of the students need somebody there to guide them, specifically somebody maybe their age, that could help guide them into like doing better for themselves and for the people around them. Next slide, please. So what are some possible solutions? Some peer movements throughout the counties. So one that I've come up with is called School Campus Community, and it's a gathering of students along with the teachers to advocate for one another. They're having activities in the classroom, such as like tutoring, maybe even arts and crafts. And I've also wanted to implement maybe field trips, since maybe money won't be the problem in this case. They can go out to anywhere, maybe to other schools, to get the word out for school campus community. They're advocating for one another, such as if somebody needs food, clothes, resources, or anything, they could always go with their kind of their partner for their friend, and they could always like talked with teacher administration. That's why we kind of need teachers and administration in this, along with doing community work such as charity, volunteering, soup kitchens, so they can get a sense of some community and some volunteer work for the resume or even jobs. So next slide, please. But would it work? Yes. So there's going to be, so in the way that I'm planning to make it, there's less division among peers. Teens would be able to open up and have connections with students their age, safer educational settings, and more going outside. And getting, as I previously mentioned, getting volunteer jobs and opportunities in specific public health. So if they're ever interested or ever deciding to be something in public health, they could always have some community work to be done. And they would be able to connect that with students their age. So they won't have to have the hard decision kind of to go up to people. And we would be going to them. So I know many people kind of like specifically in clubs, they wait for people to go to them, but we would go to the people that we see that in need of help to see if they need help to better their education status and their overall community, like how they are. So next slide, please. These are my cited sources, the kids' data and treatment plans in the public schools. And next slide, please. Yeah, thank you. Any questions?